It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you how to play a high stakes game that only the intensive care team knows how to win. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to ask the question: what would you do if you knew that you could not fail whilst your loved one is critically ill in intensive care? Having a loved one critically ill is nothing short of being a once-in-a-lifetime challenge, and if you are faced with this demanding and difficult situation, you need to get a few good strategies that gets you, your family, and your critically ill loved one through this immense challenge. You, your family, and your critically ill loved one are most likely completely out of your comfort zone. You feel vulnerable, you feel frustrated, you are stressed, overwhelmed, and you basically have no idea what the next few days and sometimes maybe even the next few hours have in store. It's a difficult situation to be in. And I'm not talking about your critically ill loved one being a quote-unquote straightforward admission to intensive care where they are in ICU for overnight admission and monitoring. I'm talking about the most challenging, difficult, frustrating, and often heartbreaking situations that you, your family, and your critically ill loved one could potentially face in intensive care, where your loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or is even approaching their end of life in intensive care. Those are the situations where I have found that families and their critically ill loved ones are the most vulnerable, where you need help, you need guidance, you need a blueprint, and you simply need to know what to do. The truth of the matter is that if your critically ill loved one is in one of those difficult and challenging situations, you certainly need to start doing your own research. You need to start looking beyond intensive care, and you simply can't afford to take everything the intensive care team is telling you for face value. For you and your family, it is extremely important to know that you need to have peace of mind, control, power, and influence in those difficult and heartbreaking situations, because if you don't, you will wind up like 99% of families of critically ill patients in intensive care who continue to take everything for face value that the intensive care team says, and you'll wind up with no peace of mind, no power, no control, and no influence. You see, after more than 15 years intensive care nursing in 3 different countries, where I have literally worked with thousands of critically ill patients and their families, I have seen over and over again that difficult, challenging, and heartbreaking situations such as your loved one is very unstable and in a very critical condition, or they are in a life-threatening situation, or your loved one is in intensive care for long-term treatments and long-term stays, or your loved one is having a severe or traumatic head or brain injury, or your loved one is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or your loved one is approaching their end of life in intensive care. These situations are leaving families of critically ill patients paralyzed, and it's leaving them in a state of quote-unquote shock and awe. You and your family need to seek a way out of the dilemma, because if you don't, the intensive care team will be calling the shots during those difficult, challenging, and heartbreaking situations. You and your family need to get peace of mind, control, power, and influence fast, because if you don't, the intensive care team will press their hidden agenda forward without you even noticing that it's happening. Things in intensive care are constantly changing in such a volatile environment without you even noticing that the things that are happening behind the scenes in intensive care are extremely powerful forces that, generally speaking, go way beyond your critically ill loved one's diagnosis and prognosis. In fact, the things that are happening behind the scenes in intensive care are so powerful that they can ultimately decide your critically ill loved one's fate and destiny. Most families of critically ill patients in intensive care are ill-prepared, and that's why they have no peace of mind, no control, no power, and no influence. Most families in intensive care are so paralyzed by fear that they therefore end up as passive bystanders, and they just witness an event, but they certainly can't control the event. I therefore ask you, what would you do if you knew that you could not fail whilst your loved one is critically ill in intensive care? We're finally getting to the bottom of our topic today here, and you need to seriously consider this question if you want to have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. Now imagine if you knew that you could not fail whilst your loved one is critically ill in intensive care. Would you start taking action? If you knew that you could not fail, would you start to proactively manage the intensive care team? If you knew that you could not fail, would you behave differently and would you start questioning things? If you knew that you could not fail, would you finally stop sucking up to the intensive care team? If you knew that you could not fail, would you automatically assume peace of mind, control, power and influence? If you knew that you could not fail, would you start looking behind the scenes in intensive care, get informed and use the information to your advantage? If you knew that you could not fail, would you believe that you are in charge of your critically ill loved one's fate and destiny? If you knew that you could not fail, would you put up with the negative positioning of your critically ill loved one's diagnosis and prognosis by the intensive care team? If you knew that you could not fail, would you automatically have and display a different and positive body language compared to 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence, and therefore have extremely poor body language? If you knew that you could not fail, how would you be positioned and how would you react in a family meeting with the intensive care team where you are being told that a withdrawal of treatment or a withdrawal of life support would be quote unquote in the best interest of your critically ill loved one? If you knew that you could not fail, would you have a different belief system from the very start if your loved one was critically ill in intensive care? If you knew that you could not fail, would you put up with the intensive care team keeping you at arm's length? And would you put up with the intensive care team hiding behind medical and academic jargon? If you knew that you could not fail, would you start questioning some of the approaches of the intensive care team? Would you start asking whether your critically ill loved one is enrolled in a medical research study without you or your loved one having given consent? If you knew that you could not fail, would you still sign an NFR not for resuscitation or a DNR do not resuscitate order for your critically ill loved one when asked to do so by the intensive care team? If you knew that you could not fail, would you still think that a quote-unquote withdrawal of treatment is really in the quote-unquote best interest of your critically ill loved one? If you knew that you could not fail, would you really think that a prolonged treatment for your critically ill loved one in an end-of-life situation would be quote-unquote in the best interest of your critically ill loved one when the intensive care team is merely continuing treatment to either earn money, keep their beds occupied, or to do medical research. If you knew that you could not fail, how would you change your behavior towards the perceived authority and the perceived power of the intensive care team? A famous saying goes like this: whether you think you can or you can't, you're absolutely right. The question is whether you think you can or you can't have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. So, how can you quickly get peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.